Hello to all the viewers. With me, I have a very special guest, Dr. Vishnu, who has secured an amazing rank of 180 in the NEET SS medical group exam. Yes, the rank 180 in a combined exam of all specialties for the medical group is a big achievement. But what makes his achievement very unique is that he's actually from a pediatrics background, and definitely anyone from a pediatrics background preparing for a medical group exam is definitely going to be tough. But I think hats off to his determination and persistence.
Thank you.
He has got such an awesome rank. Heartiest congratulations, Vishnu.
Thank you very much, sir. Thank you.
All right. Now, to begin with one question. At the beginning of your journey, when you decided, okay, I'm going to attempt the medical group, did you expect that, okay, such a good rank you will get at the national level?
Actually, initially it was a different pattern, sir. As we all know, it did not have the only core medicine group. So some of my seniors who shifted from peds to adult, they also were, to be honest, like they did cardiology and all from adult, but they went through a somewhat, if I may say, an easier pattern for a pediatric student, because most of them had to concentrate only on majorly the subject.
Okay.
But when the pattern changed, I got a bit like surprised, and I didn't know what to do. But I always thought if I have to do, then I have to get the rank. Yeah.
But I think, you are otherwise also a very academically bright candidate. Just go through your MBBS and MD days. From which colleges?
I did my MBBS from AIMS Delhi, sir, and I did my MD Pediatrics from PGI Chandigarh.
Okay, so I think your interview is very important for candidates from a pediatrics background aspiring to get into a medical group. But let me start off with this question. Why did you think of this shift from a pediatric to an adult branch?
Sir, actually, the major reason was the variety of cases that we see in adults is much more than in pediatrics, and also like some fields of pediatrics, like for instance pediatric endocrinology, pediatric rheumatology, which they are subjects and subjects which interest me. So those weren't really like the path to go through after doing DMs in them was not very clear to me.
Okay.
So I thought I had the confidence that I could crack the adult exam at that point. So I felt, why not? And yeah.
Okay. So this is again an important message to everyone, because at least some of you will be feeling, okay, pediatric background, should I go for adult? But what I have felt is, even when someone from a pediatric background joins to the adult branch, yes, the initial few months of residency might be a bit, testing. But what we always see is that you get used to the system, provided they put in that much effort. Even when I was doing DM also, we had colleagues from pediatric background. Yes, for the initial few months, they had their own share of difficulties. But after that, by second year, third year, there was hardly anything to differentiate us from the other candidates. I think so it's that you have to put in genuine effort to get into the branch. And after that also, you may have some deficiencies, especially when suppose you're taking an adult neurology. So you have to know how to deal with a cardioembolic stroke. So a bit of adult cardio also you have got to know. But I think you can cope up, provided you are in an institute with good training. So I think it is possible. Now, coming to your preparation. So how many months of dedicated preparation is required? That's what I have got to ask you as a next question.
Sir, so I basically completed my MD in last June end. Okay. After that, I worked for a couple of months or so. And after that, from around October last year, I dedicated completely my time for the preparation itself. Okay. Because I knew that those were the times when even the pattern, there were some the pattern changing was happened. Although I was not very unhappy, because I thought it was fair, the new pattern, because if you need to shift, we also need to know, as you said, the other subjects. So I kept my main attempt was for this exam only, like this session. But yeah, I gave my exam in January. And that time I could not get a like city of choice and like college of choice in neurology. And then I like studied for the INI exam in May for neurology itself. There I was getting Rishikesh neurology, but I thought I will try again. I will give at least one good attempt for my NEET SS and see like if where it can get me. So overall it was around like dedicated prep. Maybe it was for around 10 months, sir. Like obviously there are some phases where 15 days or so where we don't study like that. So it was at least 9 to 10 months. It was dedicated. Nice prep. Yes, sir.
But hats off to you. You did well in the INI also, because you got a rank of around 30 in the INI. And at that time also, you were actively involved in the interview sessions that we
Yes,
conducted, right?
with you, sir.
After
Yes,
the,
sir.
yeah. So for the viewers, after the INI initial round, for the AIMS alone, there will be an interview round. So Vishnu was there in the group where we trained candidates for the interviews as well. Okay. Now, Vishnu, vast syllabus you had in front of you. So you already made a decision, okay, I'm going to go to the adult branch. So tell us, did you have any, say, shortcuts or to, concise the whole syllabus? And what was your basic methodology of preparation?
Sir, so I am basically someone who can't take a big book and sort out small things which are important. So I am intrinsically a sort of perfectionist. I try to be. So I thought that if I'd go and try to read the whole of Harrison, then that would like get me nowhere, maybe. So I did not try that route apart from one or two small subjects like rheumatology. Other subjects I used, actually, I went back to my NEET PG prep, whatever like there's a Devesh Mishra sir's pathology book and pharmacology book of GRG sir, and there's a USMLE first aid which I had read a lot. So all those things I revised and added on one, or when the pattern changed to only general medicine, then I added on two
Got it.
sources,
Got it.
additional sources.
Got it.
But
That helps
essentially,
you rebuild the basics also, because the basic
yes,
foundation
sir.
of medicine lies in the basic subjects.
Yes, sir, definitely, sir. Like even pharmacology, they do ask core pharma questions also, like especially hemat drugs. I've seen previous questions like being asking which is not a pro drug. So
Okay.
that is like a core pharma question. So I had seen such questions also. So I thought even specific to the exam also, that is not a very bad idea. So my most of my prep was based like that, and obviously I followed our coaching, and also to help to know like specific topics like drugs affecting liver, like hepatotoxic drugs, which are specifically tested in NEET SS.
Okay.
At this time also they had come. So for that, those trends and everything, I followed our coaching, sir, and
And
also the grant test.
you were in the WhatsApp groups also of
Yes, sir.
candidates. So being in a group of candidates who were preparing for a common goal, did it actually help you, or did it put you under any sort of pressure?
In the last month, it did like put me under a bit of stress, because anyway there is stress, and then like people are putting and answering. So
Correct.
not even the last month, the last 2 to 3 weeks I was not active on the group, but otherwise I was quite active on the group, sir.
All right.
Yeah.
And what about giving the exams? Because in DocTutorials, the grant test that you gave, there were considerable number of candidates giving the exam. So did that actually help you? Because it's very important to keep a track of your progress. So
Yes,
how
sir.
well you're doing in the grant test among a bunch of the other candidates. So how did that help you?
Sir, specifically DocTutorials, there for me personally, there's no doubt that I have given like 3, 4 types of exams from various institutes, but for me, DocTutorials was very, very like closest to the exam, sir, because it is not too tough like other places. The exam is like too tough, like all the subjects. It's almost the specialty books questions that are there, but for our DocTutorials it is mainly from Harrison, and also even there are clinical questions which are not too tough like as it comes in the exam. And yes, sir. So for me, that was my most memorable moment from us.
Yeah, and Vishnu, if you remember, even while I was conducting sessions before the exam for you, I used to make a specific mention, though it is an SS exam, it is an MD exit exam,
Yes,
please
sir.
not neglect the simple questions and medium
Yes, sir.
questions. I've seen candidates just going and doing clinical lengthy questions alone. Yes, you have to do clinical lengthy questions, no doubt about it, because sometimes you may have an exam up next which is full of long stem clinical, but there is always an element of unpredictability. So if the exam is slightly shifting toward a factual, then it might be difficult for you. I mentioned the same fact a few days before the exam also when I did a session for you. And if you look at the exam pattern also, it was slightly tilted towards factual side. Agree?
Yes, sir. Definitely, sir. Like as we know, last time it was towards the clinical side, or the questions were like with images and lengthy STEM questions. But this time, almost more than 50% were like simple one, not 50% maybe, but a lot of chunk was major the one-liners.
So basically, what I understand based on the interaction with all those who gave the exam is also that, okay, this time it was more factual. The last exam was mostly clinical. So I think when you prepare for such an exam, you have got to prepare for the whole range of questions. There is no other go,
Yes,
because
sir.
there is no preset pattern. Okay, you can be sure that these percentages of questions will be clinical. So what do you think? Because you have given the previous exam also, you have a fair idea on the exam patterns, you have given the INI. So what is your take on that?
Sir, first of all, I feel INI is predictable in terms of pattern because there are obviously a set number of consultants who are setting the paper every year. But in terms of pattern, NB, we cannot expect anything to be short. It will be like this or in any way, particular way. So
Okay.
that was in mind, sir. And apart from that, the pattern itself was coming for the first time for everyone.
Okay.
So as we know, like, okay, the last time also had 40% general medicine questions, but we couldn't guess, sir, like what pattern will come because essentially it was the first time only. So I was also preparing for a mixed bag only.
Okay. So how many
Yeah,
questions did you attempt in the
I
exam?
attempted all, sir. Actually.
All the questions.
Yes, sir.
So
Yes, sir.
all the toppers who I'm interviewing, they are very aggressive, and I think that's the right way also. You should be aggressive, and I think that aggression comes from practice, because Vishnu has practiced lot of MCQs. So when you practice lot of MCQs, when you're able to narrow down to two options, you are able to make a decision. Okay, I think this is likely to be the answer. It's not a blind guess, but it's
Yes,
like, okay, an educated guess. That is what you
yes, sir.
call it. So I think practicing questions helped you.
A lot, sir. Like in my NEET PG days, I did not do so much of practice. But
Okay.
this time, as I also had time with the exam getting postponed, I did a lot of questions and or yes, sir. And it also strengthens your basics also. It every question has sometimes has a stem. So while reading the stem, you revise like 3, 4 core facts of every topic.
Okay.
So and also those are the things that get retained because you we see the question with a lot of concentration
Okay.
compared to when we are reading. So it's always very
All right. And when you went through the exam, uh, what is your take on the distribution of questions? Did you feel that any specific super specialties had more representation, or was it more or less equitable?
so cardio neuro had almost what was expected, the number of questions. Nephro usually, like what I've seen from previous papers, there are not so much of a distribution, but this time it was a good chunk.
Okay.
And to like to my sort of disappointment, there were quite less questions from rheumatology.
Okay.
There were only 5 questions, and those were also not differentiating ones. And infectious disease,
One more thing, I think around pigmented villonodular synovitis. That is one
yes,
question.
sir,
But
PVNS
otherwise,
and
the rank
RA.
differentiating questions were very less from rheumatology.
Yes, sir. Only I think 5 or 6 questions were there.
Yeah.
And infectious disease, I did not expect. I don't know if they always come, but there were quite a few questions.
Okay.
And obviously, everyone who has given the exam and heard about it knows genetics. There were a lot of questions surprisingly. Maybe it helped me a bit because of my pediatrics background, but they were also not very simple ones, which I would remember from my MD days. So yeah, but again, sir, like as you had mentioned, also we cannot expect that again genetics will come in the next exam. So yeah.
Okay. So see, you said you attempted all the questions. Approximately how many
Yes, sir.
questions approximately you got it right?
115 I got right, sir, out of 150.
115. Okay. You
Yes, sir.
attempted all the questions. Okay. Where,
Yes, sir.
when you attempted the grand test also, were you aggressive? So do you have any advice for candidates preparing up next on the strategy for grand test? So how did you assess a grand test? Like you give a grand test and did you go through all the questions or just the questions that you got wrong?
No, sir. Whenever I gave a grand test, I went through all my mistakes first. We can actually toggle the filter. So first I went through my wrong questions and then through my right questions.
Okay.
Also, like I don't know if it helped me or not. I divided the question paper into blocks because obviously our attention spans are dwindling through times, and I thought that it's better to like have set key this much, like 45 minutes and 50 questions I will do.
Okay.
It can vary from people to people, and then that block I used to like we go through the questions again at that block I used to do, and then finish it off then and there, and then move on. Like that I used to do. So
Okay. All right. And at the end of the exam, after giving the exam, were you happy or still in doubts?
after, sir, actually I have a history of not knowing how my exam went.
Okay.
Really, so I just was like blank only. But I knew it was not a very easy exam. At least I knew it was moderate to tough.
Because even after the exam, when you messaged me the rank, I think many candidates still do not assess the gravity of the rank because it's a combined exam, right? It's not a specialty exam. So I've had many candidates asking me, sir, I've got 120 or 150 or 180, 200, 220. How good is the rank? The rank is so good because it's a combined exam. So even when you give specialty exams, it is just one specialty alone, because here it's a combined medical group pool. And that shows, the effort that you have put in, because I know definitely that it's not easy. Even someone from a medical background getting such a rank is a big achievement. Okay. So hats off to you, Vishnu, for your effort that you have put in. And I think just to summarize to the viewers, especially those from a pediatric background, I think what I learned from Dr. Vishnu is that first, he said something, he was confident of cracking. So first of all, he believed that he could do it. I think that's the first and the most important step. And after that, he just had a strategy. Okay, he gave himself a period of around 10 months. And he had actually some good common sense that, okay, let me just practice the NEET PG style of questions also. Because the mistake many candidates make is they just go for the high-end questions alone. Okay, so he had that common sense with him. He practiced questions. He made it sure that he gave all the grand test also, and so that he's able to track his progress. And what was the best rank you got in the grand test?
I got around 17, 18, just around.
Okay. So he gave the grand test, and he could assess where he's standing. And I think you must have revised well also, because it's a volatile subject.
Yes.
Especially because of the vastness, primarily because of the vastness. So I think revision also is very important, right?
Yes, sir, especially for us pediatricians, because we have not, like the medicine people have revised it through their final year MD, the basics and all the core, like even topics like MI, they are like bread and butter for them, but we have not read them for 3 years in between. So for me, it was like I have to like make a few this much secure, and then I can build on my like rank or marks or preparation. So I prepared like that, sir, essentially.
All right. So hats off to you for your achievement, and thanks a lot for sparing time. I think your interview definitely is very inspiring for your fellow juniors as well preparing for the exam. Thanks a lot, Vishnu. All the best.
Thank you so much, sir. Thank you.